So your doctor's just told you that you've got type 2 diabetes. What does this actually mean? In this video, we'll be talking all about diabetes mellitus, specifically type 2 diabetes. We're going to talk about what it means, the risk factors for getting type 2 diabetes mellitus, the signs and symptoms of type 2 diabetes. We're going to talk about the management options and the most common question that I get asked all the time: is it reversible? Let's jump right into it. Hello and welcome back to my channel. My name is Dr. Grace, licensed family physician, formerly working in the UK and now working in Calgary, Alberta. Let's jump right into the video. So what is diabetes? Diabetes simply means high blood sugar. It means that the levels of sugar in your blood are really high. This is not good, and I'm going to tell you why. So when we eat, our body receives fuel in the form of sugar. This sugar is supposed to go into the cells to help us get energy to manage our day-to-day lives. However, sometimes this sugar is not able to go into the cells for various reasons, which we'll talk about shortly. This sugar then hangs around inside your blood, and your body does not like that. Now, there are several different kinds of diabetes. There are the two most common ones, which are type 1 and type 2 diabetes. Then you've got the type 3C diabetes, you've got the steroid-induced diabetes, you've got the gestational diabetes, which is diabetes in pregnancy, you've got newborn diabetes, and so on and so forth. Were you aware that there were other kinds of diabetes apart from type 1 and type 2? Let me know down in the comments below because I'm really curious. Now, we're going to be focusing on type 2 diabetes today. Now for some stats. According to Diabetes Canada, about 10% of Canadians are living with type 2 diabetes. These are the diagnosed people. If you were to add the number of undiagnosed people and people with prediabetes, that number would rise to 30%. 90% of diabetes in Canada is type 2 diabetes versus the 10% of people who are living with type 1 diabetes. Type 2 diabetes can occur due to many reasons, but the two most common reasons are not enough insulin and your body not using the insulin properly. The insulin is a natural hormone produced by your body. It's produced in the pancreas, and its main function is lowering your blood sugar levels. It has what I like to call a twin, which is another hormone called glucagon, also produced by the pancreas, whose main function is to increase your blood sugar levels. So for example, if you were to go on a chocolate eating binge, then the insulin would lower your blood sugar levels, while if you were, say, doing some intermittent fasting, that's where glucagon comes in to increase your blood sugar levels so that you don't pass out. Like I said, insulin is supposed to lower the blood sugar levels by taking the sugar from your blood and putting it in your cells. However, sometimes this doesn't work. Sometimes there's not enough insulin, and sometimes the cells are just not responding as they should. This is called insulin resistance. We still don't really know why this happens, but we know that there are some risk factors that can predispose you to getting these things, which we're going to talk about actually now. There are two different kinds of risk factors. I know I've talked about this before. We have the modifiable risk factors and we have the non-modifiable risk factors. Modifiable risk factors are risk factors that you can change, so like smoking, drinking. Non-modifiable ones are the ones that you can't change. So maybe you're Black, maybe you've got a family history of diabetes. These are non-modifiable risk factors. So non-modifiable risk factors for type 2 diabetes include being Black, being Asian, and being Native American. About 39% of people with type 2 diabetes have one parent who has the disease. And I know I'm talking about twins a lot here, but if an identical twin were to develop type 2 diabetes, then the other twin has a 90% chance of developing type 2 diabetes. You can't really help being a twin, can you? There is also PCOS, which we will discuss in a later video. There are other illnesses like schizophrenia, for example. If you had gestational diabetes when you were pregnant, there's a higher risk that you will develop type 2 diabetes later in life. You've also got the risk factor of age. It's increased risk as you get older. And then men have more type 2 diabetes than women. Lower socioeconomic classes also have a higher risk of developing obesity, specifically abdominal obesity. So if you carry your weight around your middle area, it increases your chances of having type 2 diabetes. Any physical inactivity, smoking, too much alcohol consumption, these are all modifiable risk factors, so they're things that we can change. High blood pressure and high cholesterol are also things that we can work on and change based on our lifestyle, which we will talk about later in the video. So what are the symptoms of type 2 diabetes? The most common symptoms are polydipsia and polyuria. Polydipsia means extreme thirst. You really just are thirsty and you want to keep drinking water. And polyuria means you are just peeing a ton. Slow healing ulcers and wounds. If you scratched yourself and you're finding it takes 3 weeks to heal, you should probably talk about that with your doctor. One thing I have found personally, but I don't really see in literature, is repeated boils. Lots of people will have repeated boils, and that's how some people get diagnosed with type 2 diabetes. Some people are just generally tired. They don't really have any specific symptoms. It's more vague, just general fatigue. You should speak to your doctor about that as well. Unfortunately, because of how non-specific the symptoms are, many people find out that they've got diabetes in the later stages when they've developed some complications. Now, how do we diagnose type 2 diabetes? Simple blood tests. And I know I say simple, I know some people have got needle phobia, but it's a simple blood test. So what we use these days is the A1C, which checks your blood sugar over the last 3 months. So it's not a simple case of you having a bad day. Maybe you had a chocolate binge. The second time I'm talking about a chocolate binge. So with your A1C of more than 6.5% and above. So some countries still use the older method, which is the fasting sugar and the 2 hours postprandial, which means 2 hours after you've had something to eat. So if your fasting glucose is more than 7 millimoles per liter, or your 2 hours postprandial is more than 11.1 millimoles per liter, then we say that you've got type 2 diabetes. How can we prevent this? Sometimes we really can't, especially if you have a lot of the non-modifiable risk factors that I talked about earlier. If you have some modifiable risk factors, then perhaps you can do something about it. So if you're smoking, then try as much as possible to stop smoking. I know how hard it can be, but I really believe that you can do it. Try to limit alcohol consumption. If you are overweight, try to lose some weight. If your cholesterol levels are high or your blood pressure is high, then try to reduce this as well, whether by lifestyle management or by medications. Be physically active. Work out at least for 150 minutes per week. So you can do 30 minutes 5 days a week, that's fine. If you want to do the 150 minutes at once, go for it. But don't do only cardio. Definitely do some weight training as well. Eat properly. Let's talk about the foods that raise your blood sugar immediately after you've eaten them versus the foods that either raise it a little bit more slowly or don't raise it too much at all. I know you already know most of these: rice, bread, pasta, yam, whatever tastes good. I'm joking. But corn, sweet potatoes, some fruits like bananas, watermelon, any sort of processed foods, any processed sweets, any cakes, milk, yogurt, basically anything that tastes good. I'm kidding, fish tastes good as well, but it's on the other side of the foods that have little to no effect on blood sugar spikes. Others are chicken, veggies, tofu, most nuts and seeds, salad dressing, water, obviously, and sugar-free pop. I know I do get a lot of questions asking if people can swap actual pop like Coke, Fanta for sugar-free pop. The answer is yes. It does not spike your blood sugar levels, so you are good to take sugar-free pop if you're trying to wean off of regular pop. It's a very deadly disease that really has lots of complications, from eye damage to kidney damage to nerve damage, sexual issues like low libido, or even impotence in men. It also has the risk factor of a higher chance of you getting a heart attack or getting stroke. Also diabetic foot, which is a really horrible condition that's really hard to manage. Now, we won't talk too much about this because I want you to talk to your doctor if you think you've got diabetes. Everybody's management plan is different. Some people need more injectables, some people need more oral medications. And then the only thing that I want us to really take away from today is lifestyle management, which is exercise properly, eat properly, sleep properly, stop smoking if you can, and if you need help to stop smoking, talk to your doctor about it. Limit your alcohol consumption. These are things that we can do to reduce our chances of having diabetes mellitus. To the most asked question, is it reversible? The short answer is yes, type 2 diabetes is reversible. It depends on a combination of factors like lifestyle management and basically luck. So if you're able to maintain your blood sugar levels under the diabetic range for 3 months at a time, then we term you to be in remission. Now, only 5% of people are able to achieve this, but it is doable. With this, we've come to the end of our video. I hope you enjoyed watching it. Let me know if you learned anything new down in the comment section below. As always, if you've got questions, I'm happy to answer them. Until next time, I'll see you in my next video. Bye.